In 1892, Keziah Payne DePelchin, a pioneering teacher, nurse, and social worker, took a leap of faith and accepted into her care 3 orphaned infants for whom no other accommodations were available. Keziah moved the children into a small rented house, which she christened her faith home, because, as she said, she was relying on her faith in God and her faith in the good people of Houston to support her cause. Less than a year after starting her faith home, Keziah contracted pneumonia and died. Moved by her dedication and touched by her tragedy, the Houston community embraced Keziah's vision, adopted the home, and helped it to grow. We have 2 main objectives. First, we're committed to expanding mental health services to all children with an emphasis on psychiatric and psychological specialties. 1 in 5 children will at some point struggle with a mental health issue that impairs functioning. And sadly, in our community, only half of those children will receive the care they need within a given year. The city and state's lack of mental health resources is a major barrier to children receiving the help they need and deserve. DePelchin is actively expanding its team of professionals and evaluating new locations where there's an unmet need. However, as reimbursements for mental health services remain low, and the state continues to be ranked among the lowest in terms of mental health spending, we must be efficient with our resources and innovative with our delivery. We must also look to new revenue and collaboration opportunities to help cover the cost of care. Our second objective is to continue to lead the provision of foster care and adoption services. To ensure DePelchin's sustainability and strength to take care of children today and in the future, we must grow beyond the greater Houston area and join forces with like-minded organizations across the state. In January of 2012, DePelchin merged with Caring Family Network, an Austin-based foster care and adoption agency with additional locations throughout Texas. We will continue to evaluate growth opportunities across the state and will work to make a meaningful impact on the child welfare system and the children in its care. DePelchin's strength lies with its ability to evolve quickly in order to meet the changing needs of changing times. In the beginning, DePelchin's focus was on providing basic services such as food, clothing, shelter, and nurturing to abandoned children. Over time, DePelchin evolved to become one of Houston's largest adoption agencies, finding forever families for thousands of children. As social and political norms changed, our mission expanded from just finding permanent homes for children to also finding temporary homes through the foster care system. In addition, child development professionals realized that caring for the emotional well-being of these children was just as important as caring for their physical well-being. And DePelchin responded with a range of mental health programs. Today, DePelchin is one of the largest providers of mental health, foster care, and adoption services in Texas. We continue to evolve our services so that we can best respond to children's needs as they are today. Our organization is effective because of its special brand of caring and professional level of expertise. DePelchin has always taken a holistic approach to the needs of the child. A child's physical well-being must be looked at in conjunction with their emotional well-being. A child must have a safe environment, supported by a loving family structure that provides stability and opportunities to grow. A child must also have healthy emotional well-being to thrive at home and school. DePelchin has built a team of experts and is affiliated with other great organizations to provide the best care for children. We're a training site for Baylor College of Medicine and the University of Houston School of Social Work. We're a leading center for the National Child Traumatic Stress Network and are accredited by the National Council on Accreditation. We're also a collaborative partner with the University of Texas Health Science Center and continue to look for new opportunities to partner in the Texas Medical Center. We measure our organization's success by our outcomes. We track data points such as the number of appointments within a week or the number of children in our foster care homes. And we also monitor quality measures such as the length of time to first appointment, or the number of therapy sessions before progress is realized, or the number of moves for a foster child in care. This data is continually measured and monitored by our Quality Improvement and Research and Grants Management departments and is reported throughout the organization. DePelchin-Children Center has a long history of turning lives around in Houston, which is why we enjoy a very positive reputation and strong name recognition. However, although we've evolved beyond being the DePelchin Faith Home, many in our community are unaware of the breadth and depth of our services and still refer to us as the orphanage. When they think of DePelchin, they don't particularly think about mental health, even though we're one of the largest providers of children's mental health services in our community. They also don't realize we serve all populations, not just the indigent. Mental health issues don't discriminate, so our center offers help to all children in need of quality care. One major accomplishment is the launch of our first specialty program, Autism Services, which provides multidisciplinary assessments and a range of therapeutic and educational support programs. The number of assessments has doubled each year, as has our reputation. We're now performing assessments on children not only from Houston, but around the world. Another major accomplishment is our expansion into Katy, Texas, an area with a large pediatric population, but limited child and adolescent psychiatrists. Since opening, the office continues to be fully booked with both psychiatry and counseling appointments. Another accomplishment is our partnership with UT Pediatric Clinics in the Texas Medical Center, where we have DePelchin clinicians working in concert with medical doctors to provide the best outcomes possible. Unfortunately, there's still a stigma associated with mental health that prevents many individuals from seeking the help they so desperately need. While some issues like ADHD and autism are becoming more a part of the mainstream conversation, people are still reluctant to talk about issues like depression and other mood disorders. We feel a responsibility to erode the stigma so that families are more willing to ask for help, which is why the term mental health is a part of our branding. Another challenge is the lack of resources, particularly within mental health. The state of Texas ranks among the lowest in terms of spending against mental health resources. Reimbursement rates for mental health services are significantly lower than that of primary care. All organizations are facing funding challenges, and DePelchin is working to develop stronger collaborations to more efficiently use our combined resources. With additional funding, DePelchin would expand its mental health services in more meaningful ways, making them available to all children by opening new locations in underserved areas and hiring more child and adolescent psychiatrists and psychologists. DePelchin would also focus on other specialties where there's a high need for quality services, such as trauma-informed care. With additional funding, DePelchin would invest in better technology to enhance our business operations. One example of how technology could improve the way we care for children is the use of telemedicine. Telemedicine leverages telecommunication and information technologies to provide care at a distance, allowing children in remote areas to receive the high-quality care they deserve. Even though there are several organizations providing mental health services in our community, the demand greatly exceeds our ability to serve. This demand will grow as the stigma associated with mental health diminishes and more individuals recognize the symptoms and are comfortable asking for help. It's imperative that we focus on expanding mental health services now so that we can catch up to the current demand and prepare for future growth.